It has been one of the most difficult second weeks of my 10-year career. What we saw this week was an all-out, full-frontal assault on public education, on middle-class families, as well as on those folks who are struggling to be able to afford health care in Oklahoma. As it pertains to education, the entire state has risen up and tried to tell the folks who are running this show, Governor Fowler and the Republican majority, that they need to fix public education, invest in public education, find a way to increase salaries for teachers. But what you saw this week, instead of an effort to improve public education, you saw efforts to reduce revenues for public education. Things like capping teacher health care benefits. In other words, passing the buck on to teachers to pay more for their benefits at the same time they haven't seen a legitimate pay raise in nearly 8 years. Yesterday in the Appropriations and Budget Committee, the chairman, Representative Earl Sears, instead of offering up new ways to fund public education, he offered up more mandates to hamstring the way public education dollars are spent in our schools, to eliminate local control from the students and the principals and the school board members in our local communities. When he, in so doing, he jeopardized the jobs of support personnel, bus drivers, on down the list, which are already under stress because of a lack of funds. Chairman Sears' bill would have forced school districts, against their will, to make decisions that could have harmed the ultimate outcome of support for public school children in Oklahoma. Fortunately, that bill died, but it still demonstrates where the Republican majority is. Instead of finding new ways to put revenue into the system, they're finding more ways to hamstring the system. And then third, and finally, when it comes to education, we continue to see the effort by Representative Jason Nelson to divert more money away from our public school system in the form of vouchers. They want to call it educational savings accounts, but at the end of the day, they're vouchers. His plan would allow folks in Oklahoma to take money out of the public school system and give it to private schools. We fundamentally believe that is the wrong solution for our schools. We need to invest in the public school system, not take money away from it. If we're going to get serious about funding education, we need to look at rolling back some of those measures so that we can have the resources, so we can have the revenue that we need to properly fund education. Middle-class families have been under attack. You saw Senator Mazie offer up a series of tax increases in the state Senate just this week that would drive up the cost, the income tax cost for middle-class families by eliminating the child care tax credit and the earned income tax credit in Oklahoma. That is the wrong approach. Instead of learning from the lessons that put us here, cutting taxes on the wealthy, cutting taxes on the most powerful industry in the state, and say let's roll back some of those tax cuts. Instead, they're doubling down on measures that hurt middle-class families by offering up tax increases for those middle-class individuals and those families in Oklahoma. To top it all off this week, in a week in which you saw bad education policy, bad tax policy for middle-class families, you saw a bill pass out of the House A&B Health Subcommittee yesterday that would push off over 100,000 people off of Medicaid, forcing them away from their insurance plan that currently allows them to take care of themselves and their families. In a state that desperately needs to expand coverage for health insurance, the Republican majority is reducing coverage for the insurance coverage in Oklahoma. With 1 in 5 of our citizens without any health insurance, that's roughly 200,000 people that could be taken care of through the expansion of Medicaid and bringing our federal dollars home. The Republican majority has said, let's add 110,000 more to those uninsured rolls. That is unconscionable. It's because of their fiscal decisions and refusal to bring our Medicaid dollars home that hospitals like the one in Sayre went bankrupt. The hospitals like the one in Craig County and LaFleur County are on the verge of bankruptcy. And the Republican majority needs to come to the table and understand that the solution isn't forcing more people onto the rolls of the uninsured. It's expanding the insurance coverage in Oklahoma. It does seem as if the folks running the show have taken their eye off the big target, off the big goal this year, and that is finding a way to balance the budget and to do so without balancing it on the backs of middle-class families. Every year we have pieces of legislation that flow through here that in general are pretty inconsequential, and so that's nothing new. The problem is the optics look really bad. When families in Oklahoma are struggling, when there are people in Oklahoma who are in danger of losing their health insurance coverage, when there are teachers in danger of losing their job, when class sizes are growing to nearly 35 kids in some classrooms, when the Republican majority runs out a bill that deals with daylight savings time instead of truly addressing the issues at hand, it looks as if their focus isn't where it needs to be.